What's up, everyone? Welcome back to the channel. The supplement industry is massive, but natural doesn't always mean safe, especially for seniors managing health conditions or prescriptions. Today, we're breaking down 9 supplements seniors should avoid without a doctor's approval. The supplement world is like the Wild West, unregulated, unpredictable, and sometimes dangerous. Your body changes as you age, so what worked in your 40s might be risky in your 70s. Let's dive into the list and see why talking to your doctor is non-negotiable. First up is St. John's wort, a supplement that's been around for centuries and is often found in health food stores and pharmacies. Many people are drawn to it because it's labeled as natural, and it's widely promoted as a gentle way to boost mood or help with mild depression. But for seniors, St. John's wort is far from harmless. It's a minefield of drug interactions that can quietly undermine your health, especially if you're already taking prescription medications for chronic conditions. Here's why. St. John's wort speeds up your liver's cytochrome P450 system, a group of enzymes responsible for breaking down many medications. This means your body can clear out important drugs much faster than it should. As a result, blood thinners, heart medications, statins, and even some cancer treatments may become less effective, putting you at risk for serious complications. Imagine thinking you're protected by your prescriptions, only to find out they're not working as intended. The danger doesn't stop there. If you're on antidepressants, combining them with St. John's wort can trigger serotonin syndrome, a potentially life-threatening condition that requires immediate medical attention. Symptoms of serotonin syndrome include agitation, confusion, rapid heart rate, high blood pressure, and sometimes even tremors or fever. It can come on quickly and escalate before you realize what's happening. The risk is even higher for seniors, who are often juggling multiple prescriptions for different health issues. The more medications you take, the greater the chance for dangerous interactions. Marketing paints St. John's wort as a gentle, natural alternative, but don't be fooled. Just because something is labeled natural doesn't mean it's safe for everyone, especially when it comes to your medication balance. You might not even realize your supplement is sabotaging your prescriptions. The effects can be subtle at first, but over time, they can seriously impact your health and well-being. Bottom line, if you're a senior on any medication, don't take St. John's wort without a thorough review by your doctor and pharmacist. They can help you understand the risks and make safer choices. There are safer, better regulated treatments for depression and mood disorders that won't interfere with your essential medications. Your healthcare team can guide you to options that are both effective and safe. Don't risk your health for a supplement that can quietly undo the benefits of your essential medicines. The consequences can be far-reaching and sometimes irreversible. Always consult your healthcare team before adding anything new to your routine, even if it seems harmless or is sold over the counter. The interactions between supplements and prescription drugs are widespread and can be incredibly serious, especially for older adults. Seniors are especially vulnerable due to polypharmacy, the use of multiple medications at once, which increases the risk of harmful interactions. Even if it seems natural, St. John's wort can have drug-like effects that are powerful enough to disrupt your treatment plan. Protect your health. Skip this supplement unless your doctor says otherwise. It's not worth the risk to your well-being. Your medication's effectiveness and your overall health depend on making informed choices. Let's move on to the next supplement to watch out for, because when it comes to your health, knowledge truly is power. Next up is ginkgo biloba, a supplement you've probably seen promoted everywhere for its supposed memory-boosting powers, especially among older adults. But here's the truth. The scientific evidence supporting its benefits is weak at best, and the potential risks are much more significant than most people realize. Ginkgo acts as a blood thinner, which means it can increase your risk of dangerous bleeding, especially if you're already taking blood thinners, aspirin, or even certain pain relievers. For seniors, even a minor fall or bump can quickly become a medical emergency if your blood doesn't clot the way it should, turning a simple accident into a life-threatening situation. Ginkgo can also interact with a wide range of medications, sometimes reducing their effectiveness or causing unexpected side effects that can be hard to predict. On top of that, supplement quality control is often poor, so you never really know what dose you're getting or what else might be in the bottle. The promise of a sharper memory simply isn't worth risking a serious bleed, especially when the benefits are so uncertain. If you're concerned about memory loss or cognitive decline, talk to your doctor about safe, evidence-based options that are actually proven to help. Don't gamble with your health or take unnecessary risks for a supplement that's more hype than science. Unless your doctor specifically recommends ginkgo, it's best to skip it and focus on safer ways to protect your health. Let's keep moving. Let's talk about vitamin E. Once hailed as a miracle antioxidant, high-dose vitamin E supplements actually increase your risk of bleeding and even hemorrhagic stroke. For seniors, especially those on blood thinners, this is a serious danger. Studies show high doses don't prevent heart disease and may even increase heart failure risk. Get vitamin E from food: nuts, seeds, leafy greens, not pills. Toxicity from food is nearly impossible, but supplements can push you into the danger zone. Unless your doctor diagnoses a deficiency, skip high-dose vitamin E. Focus on a balanced diet for your nutrients. Number 4 on our list is ginseng, a supplement that's become incredibly popular for boosting energy and helping people cope with stress. Many seniors are drawn to it, hoping for a natural pick-me-up. But while ginseng is often marketed as a safe herbal remedy, it can actually be quite risky for older adults, especially those with certain health conditions. Ginseng can lower blood sugar to dangerous levels, particularly if you're already taking diabetes medications. This can lead to hypoglycemia, which is not only scary but can also be life-threatening if not caught in time. It can also cause your blood pressure to swing unpredictably, sometimes raising it, sometimes lowering it, making it much harder to manage heart conditions or hypertension. Ginseng doesn't just stop there. It interacts with blood thinners and many heart medications, which can make the effects of your prescriptions unpredictable and potentially dangerous. Common side effects include trouble sleeping, feeling nervous or restless, and frequent headaches, issues that can really disrupt a senior's quality of life. Instead of a gentle energy boost, you might end up feeling anxious, jittery, or even more exhausted than before. For seniors living with diabetes, high blood pressure, or heart disease, taking ginseng is a risky gamble that could make managing your health much harder. That's why it's so important to always talk to your doctor or healthcare provider before trying ginseng or any new supplement, no matter how natural it seems. There are much safer, proven ways to boost your energy and manage stress, like gentle exercise, meditation, or simply getting enough rest. Let's move on and take a look at the next supplement on our list. Number 5 is kava, marketed for anxiety and sleep. Kava can cause severe liver damage, even liver failure. Seniors are especially at risk due to declining liver function and common medications processed by the liver. Combining kava with alcohol or other meds can overwhelm your liver. Kava is also a strong sedative, increasing fall risk and dangerous drowsiness. Its natural label hides real dangers: grogginess, impaired coordination, and even life-threatening injury. Safer, well-researched options exist for anxiety and sleep. Don't risk your liver or safety for kava. Talk to your doctor for better solutions. Let's keep going. Number 6 is yohimbe, often sold for sexual health and weight loss. Yohimbe is a powerful stimulant that can spike heart rate and blood pressure, dangerous for seniors with heart issues. It can trigger palpitations, anxiety, panic attacks, and even heart attacks. Side effects are severe and unpredictable, especially with unregulated doses. Yohimbe also interacts dangerously with antidepressants and blood pressure meds. The risks far outweigh any potential benefits. If you're seeking help for erectile dysfunction or weight loss, talk to your doctor about safer, proven treatments. Don't gamble with your heart health. Avoid yohimbe entirely. Next up, vitamin A. Vitamin A is essential, but high-dose supplements can be toxic, especially for seniors. Your body stores excess vitamin A, and as you age, it's easier to build up to dangerous levels. Symptoms of toxicity, dizziness, nausea, headaches, are often mistaken for aging. High vitamin A intake weakens bones and increases fracture risk, especially hip fractures. The risk comes from preformed vitamin A, retinol, in supplements, not from plant-based beta-carotene. Most seniors don't need extra vitamin A unless diagnosed deficient. Check your multivitamin labels and avoid high doses. Get vitamin A from a balanced diet, not pills. Protect your bones and overall health. Let's talk about iron. Number 8 is iron. Iron is vital, but your body can't get rid of excess. Supplements can cause toxic buildup in organs. Iron overload damages the liver, heart, and pancreas, and may worsen diabetes. It can also increase oxidative stress, possibly affecting brain health. Only take iron if a blood test confirms deficiency and your doctor prescribes it. Self-diagnosing fatigue and taking iron is risky and can cause severe side effects like constipation and stomach pain. Don't guess, get tested. Too much iron is as dangerous as too little. Respect this mineral and use it only under medical supervision. Now, let's finish with calcium. Number 9. Calcium supplements. Long recommended for bone health, but new research links them to increased heart attack and stroke risk, especially from supplements, not food. Pills can spike blood calcium, possibly leading to artery calcification and kidney stones. Dietary calcium is safer, your body absorbs it gradually. Most studies show vitamin D is more important for fracture prevention. Focus on getting calcium from food and ensuring adequate vitamin D. Only supplement if your doctor recommends it after assessing your risks. Don't follow outdated advice. Personalize your bone health plan. Talk to your doctor before starting calcium pills. Let's wrap up. That's 9 supplements seniors should avoid without a doctor's okay. Natural doesn't mean harmless. These supplements can have powerful, risky effects as we age. Always consult your doctor before starting anything new. Your health is your most valuable asset. Protect it with knowledge and medical guidance. If you found this helpful, like, share, and subscribe for more evidence-based health tips. Stay safe, stay informed, and see you next time.